Hi, I'm going to talk about cultural competence in the LGBTQ patient. My name is Charles Johnson, and I'm in a class in the RN BSN program called Interprofessional Communication and Improving Patient Outcomes. The professor is Professor Marissa Tierney. So, why is cultural competence important with regard to the LGBTQ population? Although there has been positive steps forward, the LGBTQ community still faces barriers in healthcare. Studies show that few health institutions collect data on gender identity, thus making it challenging to measure the quality treatment decisions and outcomes of healthcare provided to transgender patients in the LGBT community. Now, what can we do about this? Well, we must always be kind. Many LGBTQ people have difficulty acquiring health care where they feel they are accepted, understood, and they do not fear discrimination. Some ways that can be used by a healthcare provider include improving basic communication, avoiding assumptions and stereotypes, and using preferred pronouns and names. So if they tell you, I prefer to be called she or he, you can do that. Registered nurses, advanced practice nurses, and physicians are encouraged to become trained in how to provide respectful, quality care to the LGBTQ patient. Now, look, I messed up my lettering, so even I, as an ally, have to be careful not to mess up the lettering. Now, identifying barriers that affect the LGBTQ population. How do we do that? Well, there has been a great lack of LGBT education in nursing schools, according to Substance Abuse and Mental Health Services Administration. In a 5-year period in the early 2000s, there were only 8 articles regarding LGBT health out of 5,000 articles in the top 10 nursing journals. And so maybe I can even write an article about it because I like writing about this topic. Ultimately, many just do not realize this is a problem. So many professionals don't help professionals, and people don't think that this is really a problem, and they're not aware of it. But this is a part of cultural competence. Creating the environment, healthy. How do we do that? Well, Healthy People 2020, and I know 2030 is also, but in 2020, they formed a goal to improve the well-being, safety, and health of the LGBTQ patient population. Educate yourself and your staff on the LGBTQ population, and they will be more comfortable caring for them. An LGBT symbol and non-discrimination statement can be placed at your front desk in the clinic's patient's waiting area. Yeah, so of course you are welcome here. All are welcome. Anything that you can place to let them know you're making a conscious effort to think about them would be a way to go. Creating the environment continues. Asking those questions about sexual orientation and gender identity is okay to implement appropriate care of the LGBTQ patient. Provide content on clinic submission forms that ask questions pertinent to providing patients the opportunity to self-identify as LGBTQ. Accept that you might be ignorant to the patient's way of identifying themselves. Just because they look like a female don't mean they may consider themselves female. Many don't. Sometimes they will, sometimes they won't. You have to keep an open mind. The nurse advocate in the LGBTQ. Now, I hope that many nurses and healthcare providers can advocate for all their patients, including the LGBTQ. Nurses should provide all patients with culturally competent care as well as inclusive and ethical care. Nurses should work to decrease health disparities and discrimination against the LGBTQ community. Nurse educators can increase the knowledge of LGBTQ needs by incorporating the subject into their courses. So be willing to teach. So what are my comments? My comments are always try to be aware of different cultures that you come across, including the LGBTQ, period. I say period because I really emphasize that, because no matter who you are taking care of, they deserve your undivided attention and quality health care. But don't be a know-it-all. And, I check myself because sometimes I think I know something, but I don't know everything. And I definitely don't know everything about the LGBTQ, and I'm open to learn. And it's a very inclusive, they're very inclusive, so there's always, sometimes I would say, oh, there's another letter, and I check myself because they're very inclusive. Check your preconceived notions. Don't have any. Be aware of how other people may view you, even if you know you are not that way. So, people have preconceived notions about you in the community, and they're scared to come forward of who they are. Make sure that you are very open and be kind. I thank you for your time. Let's look at my references. These are my references. I included myself because I would like to write about this topic, and I probably will go on to write another paper about this topic. And it's very dear to my heart. Any sort of disparity among any culture is near and dear to my heart, including the LGBT community. So I really like these topics, and I hope you learn something, and I hope you treat all your patients with kindness and be inclusive and provide quality care. Thank you.